I do have to say, though, that the key here is not bringing lots of people together, not traveling.
Hello, I'm Faith Rogers, host of today's program, COVID-19 Keeping Up with a Moving Target. This is the November 18th update of DKB Med Radio's Coronavirus Educational Series. Thank you for joining us. Please note that we will not be hosting our regularly scheduled COVID program on November 25th or 27th. We will resume the program on December 2nd. This activity is jointly provided by the Postgraduate Institute for Medicine, DKB Med, and the Institute for Johns Hopkins Nursing. Today's program is accredited for ANCC and AAPA credit, as well as AMA PRA Category 1 credits. Please visit our website for complete CE information. If you're tuning into our webcast, please click the red Claim Credit button in the webinar console to attest for credit. Otherwise, please visit covid19.dkbmed.com. There you will also find all of our previous COVID-19 programs and have access to other free CE programs on a wide range of topics. Today's learning objectives are: discuss the CDC recommendations for holiday gatherings and describe the current status of vaccine development. This activity is supported by an educational grant from Pfizer Incorporated and in kind by DKB Med. All activity content and materials have been developed solely by the activity directors, planning committee members, and faculty presenters. With us today, we have Dr. Paul Auwaerter, Clinical Director of the Division of Infectious Diseases at Johns Hopkins School of Medicine. Dr. Auwaerter, we're glad that you could be here today. Thank you.
Thank you, Faith. And as we're recording this just before the Thanksgiving holidays, this sort of will be a holiday-based program because many people I know are thinking about what to do with not only Thanksgiving, but the December holidays. The number of cases worldwide continue to be in the areas that unfortunately are very similar to what was going on in the spring at high rates. Europe, North America, primarily the United States, but also Central and South America. However, what has happened here in a very graphic way, you can see the number of tests that are positive are again increasing, and this time the percentage is over 10% despite having a substantially increased amount of testing, over a 1.5 million tests daily, which is substantial. However, I don't think we have the full picture because estimates are we probably need 3 to 4 million tests a day, and already we're beginning to experience bottlenecks. People have to wait to get tests, or the reporting periods are being extended to more than just a day or two. And this will all potentially impact care and treatment, as well as being able to help inform people what they should do. Because importantly, I find that many people don't end up quarantining while tests are pending if they feel they've had a close contact or even if they're ill. So by slowing down this testing, I think, unfortunately, people that may have minimal symptoms will continue their usual activities and perhaps put others at risk. As you look at this map, which I have to say I look at almost every day, and during the late summer and early fall was a healthy amount of green on the East coasts, the West coasts, and so on, but has become less and less so. Remember that 5% is at least one benchmark where if rates are below that, community spread is at least somewhat manageable and some normal activities might go on. However, everything's relative, and if rates are increasing, regardless if you're going from 2 to 3% or 5 to 6%, it's worrisome in that trend. And if you're expecting to travel during the next few weeks and into December, I think you have to think very strongly about where you're going or where people are coming from. But the general advice is don't travel. And as you can see, you can get some idea of the density of infections and community rates, at least over the past week, have very much centered in the Midwest, even in the rural areas and the less densely populated plain states, for example, and the mountain states have much healthier percentages. But even areas that had relatively low rates, and I'm speaking of parts of the Mid-Atlantic and San Francisco and California, have increasing rates. And the question is, do you do something about it now or wait until there's even more cases and potentially have an effect where, once again, we're looking to flatten the curve to really save our hospital systems? There's a patchwork of different approaches across our country. I thought this graphic from the New York Times was interesting. First, looking at mask mandates, which are not every state, but sometimes will be changing over the week. Businesses have a variety of restrictions in several states, but the stay-at-home orders are nothing quite like the lockdown. However, most, if they are doing stay-at-home, are on an advisory basis and may be very localized, for example, as Chicago, whereas the state itself still has no restrictions. So you do certainly need to have a full understanding of where you're going to, which again, I don't advise if you can at all help it. And then making sure you know the state requirements. For example, Massachusetts requires testing beforehand. New York requires testing beforehand, then a 3-day quarantine and additional testing, all of which gets fairly involved. The reason many of these states have adopted these at the moment is the following, and this is especially important as we head into the holidays, because why is this virus so successful? It is so successful because it takes advantage of our innate human nature, is that we like bonding, we like sharing time, we like being close to people. And this virus, which can often transmit before people have any symptoms or never develop any symptoms, means that most infections are actually acquired at home. So someone in the household that you could be sharing a dinner with or coming and visiting during the holidays then spreads it. This is where most occur, and which is why there's such strong advice to stay at home and keep it small. Now, the super spreader events have certainly gotten a lot of attention, and this is where people might be singing in a choir, or they're at an indoor event, or in a bar or a restaurant. However, these will help spread to a wider range, but the sheer numbers of them mean that they're mainly acquiring at home. And this is very important because I think at home, we do let down our guard. And if there are people that are at high risk at home, really you want to take great care, even wear masks within the home, especially for people that might have activities and circumstances that would place them at higher risk. For example, this is a recent publication that looked at what happened earlier this year in May when Wisconsin's emergency home order for staying at home was lifted. And the group that you can see had a rather rapid increase in cases rather dramatically were the people between 18 and 23 years of age. Of course, these are college students. These are people who are trying to explore friendships, meet new friends, are usually incredibly social. And these are precisely the people, of course, who will be coming home for the holidays. College students offers, unfortunately, a super spreading event in reverse. Everyone was worried when they went to school in August and September, but now they're coming home. Many schools are testing before they leave. In fact, some schools like Notre Dame, for example, if you don't get tested before you leave, will not be allowed to register, is my understanding. So some have taken rather draconian measures. However, it's probably for the best to try to help lower risk to make, if it's possible, to have your college person tested before they re-enter the home environment, especially if people are at higher risk, and that's going to be people over 65, people with health problems, people with obesity, and so on. So these are the CDC recommendations. And they say to limit your numbers or keep to your bubble, meaning the people that you tend to see and you know their behaviors. If community rates are increasing, there's more danger. Well, unfortunately, this is almost everywhere in the country. If you need to do something, you do it outside because we know transmission rates are much less in well ventilated outdoors. Keep duration short, wear masks even indoors, socially distance, and avoid loud talking and singing. However, many people have said these CDC recommendations are too lenient. I'll give you an example. Back, I believe in September, Israel actually went to lockdown during the religious holidays because they did not want everyone getting together, which would lead to a rapid increase in COVID cases. Canada, Justin Trudeau canceled any in-person gatherings. And Bill Schaffner, who I well respect and is a professor of infectious diseases at Vanderbilt in Nashville, thinks, and I think many think this too, that Thanksgiving will be a super spreader event. In fact, he said, I'm convinced just looking at the way our general population is currently behaving. And many people are just so sick and tired of being apart and so on. I'm afraid this inclination to bond and see one another is just the weak point, the Achilles heel, as it were, for this virus to take advantage of you and your families. So returning to the CDC, the no-go recommendations are as follows. Obviously, anyone that's had a close contact with someone with COVID-19 or has tests or tests pending if they're symptomatic and so on, you really should be staying at home and not traveling. These have been longstanding recommendations, but just to reinforce. I would say anyone at risk for severe illness should think very hard about attending in-person gatherings for people that are not living at home with you. Essentially, again, this is always a numbers game. The more people you see, the more chances that you might acquire infection. Activities are sort of listed here into lower risk suggestions. I'm not going to read them all. This deck will be available. You can look at it or go to the CDC website. I do have to say, though, that the key here is not bringing lots of people together, not traveling. I mean, I fielded a number of patient questions, and it was really quite remarkable to me. Someone's asking, well, they gave me a whole laundry list, and they're having 23 people coming to their house from 8 different states, and they're wondering how to exactly segregate people around the table to reduce risk. And I suggested that I could not give them any opinion, and I would just suggest avoiding that particular indoor activity, especially since they had high risk individuals at home. In closing, I would like to spend just a few minutes on prevention because even though we have very bleak news now with incredible rates across the country, the only small silver lining is people are not probably as ill as they were back in the spring. We have less ICU admissions as a percentage, but the vaccine race is highly interesting. I have to say, surprised so many of us with at least 2 vaccines that have had press release data, preliminary data suggesting over 90% efficacy. Both of these are mRNA vaccines, which are RNA wrapped around lipid particles and injected into muscle with 2 different shots. This rather extraordinary efficacy, I think, bodes very well, especially if vaccines are not widely taken up by our public. Obviously, the more efficacious a vaccine, if we can get to 50 or 60% of people immunized by the summer or fall of next year, this will have a substantial impact. Interestingly, I have to mention something that got very little press, but at least the Gamaleya vaccine, that's the Russian vaccine that's been labeled Sputnik, is an interesting vaccine that's 2 shots, but it uses 2 different adenovirus vectors. They too are reporting over 90% efficacy with this strategy. Many people were worried that adenovirus, to which many of us have been exposed and may have partial immunity, meant that people may not get as good and robust responses. So this too is very encouraging. The fact that 3 out of 3 are in this range, I cannot tell you how extraordinary this is. Of course, the challenges that we face now are distribution. Once more data is accumulated, and if the Food and Drug Administration approves such vaccines, we still don't have the full safety profile. But for perhaps the more intrepid or the people at higher risk, I think it'll be worth the gamble because we'll certainly have an early safety signal with these initial data. Lastly, some of the monoclonal antibodies have been in the news. Regeneron has a 2 monoclonal antibody cocktail, which had preliminary data released. They are in front of the FDA for an EUA, but Eli Lilly has this monoclonal antibody, which was published recently in the New England Journal in the Blaze trial. And this was a dose finding phase 2 trial that looked at a variety of doses, 700 to 7,000 milligrams infusion of this one time in outpatients who had symptoms of mild to moderate COVID and confirmed disease. They looked for a virologic endpoint that didn't work, but their secondary endpoint did say that it reduced in people who received the monoclonal the need to go to the ED or hospital, which was the basis for approval. There is a healthcare provider EUA that gives you all the details that you need to have confirmed disease, be over 12 years of age, and be in a high risk category, and those are outlined. At the moment, many states are still figuring out distributions. We have not infused a dose yet. And I would say with the testing bottleneck, it is important because most people here in this study had only 4 days of symptoms at the time of infusion. And really, the earlier you can get this antibody, the better it will be for you. So if these testing delays continue or worsen, I think there'll be less impact from this monoclonal antibody, which unfortunately is not being even made in very great amounts, at least at this stage.
Dr. Auwaerter, thank you again for those updates. If you're tuning into our webcast, please click the red Claim Credit button in the webinar console to attest for credit. Otherwise, please visit covid19.dkbmed.com. Any questions or issues, feel free to email us at the address listed. To submit questions, please send them to qa@dkbmed.com. That's Q as in question, A as in answer, at dkbmed.com. Again, thanks for joining us, and thank you for your dedication to your patients with COVID-19. Thanks again, Dr. Auwaerter.
Thank you, and I hope you all make your holidays safe for yourselves and your families and friends. Thanks for listening.